because I know that you still work actively in healthcare as a nurse, and get your reaction to the story we're just discussing this morning, the news of the alleged invasion of the Princess of Wales's privacy with snooping on her medical records. What do you make of that?
Well, I don't want to comment specifically on her case, Princess of Wales, because it is under investigation, I understand, by the Information Commissioner. But more widely for all patients, you know, it is against the rules to be looking at patients' notes if you're not involved in their care and if you don't have their permission. These are pretty strict rules that have been in place for a long time, and that crosses across all sectors, in hospitals, in communities, settings. And so it's pretty strict rules for a reason, because these are people's confidential notes. And so my nursing regulator, the NMC, would certainly investigate any breaches by nurses. But these are pretty sensitive data for anyone, and that's why those rules are in place.
And of course, this isn't just anyone we're talking about. This is the future Queen. And obviously you don't want to comment on the individual case. But as a principle, you know, are there serious questions, do you think, for this hospital going forward, for the royals to be able to trust it? It's been a favoured hospital for the royal family for many years.
Well, it seems that there's been an instance that they have picked up. They've done the right thing. They've reported it to the Information Commissioner, and so those restrictions and those safeguards are in place, and they seem to have identified a problem and acted on it pretty quickly. But as I said, you know, the Princess of Wales has been pretty candid that she was having surgery and won't be in action till after Easter. I want to respect that and don't really want to speculate on her individual case. But just to reassure patients up and down the country that these rules are in place for everyone, and if there is a breach of those, they will be investigated by the Information Commissioner, and your healthcare regulators will also take action against individuals who breach those rules.
Well, let's talk about the rules under Secretary of State as regards. Can you tell me what is the single biggest entirely preventable cause of ill health, disability and death? What is it?
So it's smoking, and it causes over 80,000 deaths a year, and that's just the individuals it affects. That's without the families and loved ones who lose people from smoking-related illness, whether that's cancer or heart disease. It's entirely preventable, and so the legislation we're bringing forward to Parliament today will, for the first time ever, introduce a smoke-free generation. So anyone who turns 15 this year will never be legally able to buy cigarettes going forward.
An awful statistic.
Not just cigarettes.
Yeah, 80,000 lives in Britain every year are taken because of smoking in some form or other.
That's right, and that's without looking at the additional illnesses that people have that they don't necessarily die from. So we've got respiratory illnesses, things like strokes, even your teeth. Smoking has a devastating impact on your gums. It costs the country as a whole about £17 billion a year. So although we make some tax revenue from tobacco products, we actually spend far more on treating the consequences.
It's been a pet project, this, of the Prime Minister, hasn't it? But I put it to you that perhaps on this he might be a bit behind the curve. You speak to any parent of youngsters in secondary school and none of them are smoking. The issue is vaping, and you only have to look at the front of the Times this morning and they're seeing links now between vaping and cancer. Have we been right to push people towards vaping, and do we perhaps need to look at legislating against vaping to protect our young?
Well, the legislation that we're bringing forward does include measures on vaping as well. It's already illegal to sell nicotine-based vaping products to children, but there is a loophole, and manufacturers have created flavoured vapes instead, which don't have nicotine, but we don't necessarily know the safety profile of those vapes either. So in the legislation, we will close that loophole, and so any vaping product will no longer be able to be sold to a child. Flavoured products, the way they're sold, the packaging, where they're displayed in shops, because you're right, we don't want children to start on a path of vaping. Because our motto is if you don't smoke, don't vape, and children should never vape, because we are not 100% sure about the long-term safety effects of vaping overall.
Very quickly, we're expecting inflation figures out in the next few minutes, widely predicted to come down by something like 0.5%. Is it time for the Bank of England to bring interest rates down as well?
Well, I'm sure the Bank of England will look at the inflation rates today, but this is, if it comes down as predicted, this is good news for ordinary folk up and down the country. It's on top of our cut in national insurance, which is coming through, the increase in the living wage, which will happen, next month, the reduction in the cost of energy bills. So, it's coming together for people. People have had a hard time over the last couple of years, but hopefully our plan is working and people will start to feel that difference in their pockets.